Georgetown. I'm Beverly Enos and you're watching Spotlight Georgetown. You can find us Fridays, Saturdays, and Sundays, 8 a.m. and 8 p.m. This is your cable station. You own it. It's here. It's built for you. So if you'd like to be part of it and learn how to run a camera or do some editing, if you would like to be a guest, that's the hardest part of my job producing this, is finding people that are willing to come and talk to us. So if you know someone that you would like to volunteer, or if you'd like to be here yourself, please let me know. Now today we're going to be talking about Express Care, and we're talking to Bill Plant and Dr. Garrett Bomba. Welcome, both of you.
Thank you very much. Thanks for having me.
And you are the medical director of Express Care.
I am.
And Bill, your title is?
I do marketing and communications for Pentucket Medical.
So this is all, and Express Care is part of Pentucket Medical?
Yes, it is.
Okay. Now, where are each of you from?
So I grew up in Salem, New Hampshire.
Okay, so that's close.
Yep, very close. Yep.
That's close. And you live now?
Wyndham, New Hampshire.
Okay.
Yep. Yep. So
my favorite golf course. That's my hole-in-one golf course.
Oh, is it really? Congratulations.
Thank you.
Not a lot of people can say that.
How about you, Bill?
I grew up in Newbury, and I live in Amesbury, where I've lived for about 30 years.
So you're both still pretty local.
We are local. Yep.
Local with, A-L.
Yeah.
Not loco.
No, local. Now, Pentucket Medical services Georgetown, which is one of the many communities that you service.
Yes.
That's correct.
And how far does Pentucket Medical reach as far as patients and clients?
Basically, say 15 miles either side of the Merrimack Valley.
Okay.
Pretty much from Plum Island to Tewksbury out toward Lowell.
All right, that's quite a distance.
Mm-hmm.
Now, it's actually located right on the Merrimack River.
Yes, 500 Merrimack Street, the urgent care, yes.
The urgent care.
Yep.
And it's part of Pentucket Medical that's there as well.
There's an office at Riverwalk, which is where the big smokestacks are, exit 44 off 495.
So it's Merrimack Street, right?
Correct.
Mm-hmm.
Okay. That's the exit that I take to get there. Now, tell us a little bit about your background and why you chose to be a physician and what you went through to get there.
Okay. Well, I already told you I was born and raised in Salem, New Hampshire. I think my decision to become a physician started probably at the end of college when I took an EMT course and started working actually at Canopy Lake Park as an EMT. I did that for a few years and really loved it, so I went to medical school, finished up residency, and actually for 7 years was an attending in the emergency department in Manchester, New Hampshire, one of the local hospitals there. And after about 6.5 years or so, Pentucket Medical approached me about starting up some urgent care services, and we formed a bond there and opened up the facility, and never looked back since.
Now, what is urgent care and what makes it different from an emergency room visit?
So urgent care is different in that we can't take care of life-threatening emergencies. Meaning if you think you're having a heart attack, if you think you're having a stroke, if you think that your arm needs to be reattached to your body, I'm probably not the guy for you. Now, when I'm working in the emergency department, I am, because we have the facilities to take care of those things.
Right.
In urgent care, geared more toward, I would say...
fall down, break your wrist.
Exactly. Fall down, break your wrist, sore throat, colds, rashes, broken bones, things like that, where we have, X-ray, laboratory services and such.
Okay, I'm going to interject the reason that you're both here. A few weeks ago, I got up in the middle of the night. I tripped and fell. I knew I had done something really bad because it really hurt. I wrapped it up, put some ice on it, and I thought, emergency room, hours and hours and hours. And then I said, I had been to Express Care before, and I said, you know what? They open first thing in the morning. So at 7:30 in the morning, I got myself down there, and within 45 minutes, I was out the door with the X-ray disc in my hand and an appointment to have my cast put on.
That's great to hear.
45 minutes, $18 instead of the $500 deductible that it would have been for the emergency room. And I made my trip to Maine that weekend.
Oh, that's great. That's the most important thing.
It was like, do I have time for this? But I was just so stunned. That's one of the reasons that I called Bill and said, okay, can we put this together and have you guys here? Why are waiting times in the ER so long?
I think one of the frustrating things for both physicians and patients about the emergency department is its function is to take care of those life-threatening emergencies. So if you're there as a patient who falls down at 4 o'clock in the morning and has a broken bone, we can assume you're sitting in the waiting room with that broken bone but those 15 patients that just came by ambulance in a car accident having chest pain, those people unfortunately have to be triaged ahead of you. And so while you're in the waiting room looking around saying, why haven't I been called next? The doctor behind the scenes is taking care of all these other things that need to be ruled out before they see the broken bone that we know is, a stable thing. Not stable for you because you're in pain and you want to go to Maine, but, stable from a medical standpoint. So that's probably where we're waiting. And then, of course, volume. I mean, there are some times that, the emergency department is just inundated with, 100 patients at a time.
Right. And when you go into the ER, do they have to check, like, let's say they want to do x-rays, do they have to check with the insurance company before they can do that, or
in the
schedule tests? Or
they do not generally check with the insurance companies. They generally, usually it's covered if it's an emergency. In an emergency department, that's kind of something that's...
Because when I went and checked in, they took my insurance, and we knew it would be all set. The other nice thing that happened was the nurse that was there, she actually set it up so that when I went for the x-rays, she walked me through the building to x-ray and then walked me back.
I think the best part of the Express Care is our staff.
Yeah,
they're phenomenal.
Right. I was just amazed at how fast it went. What's the average wait at Express Care?
I would say the average wait would probably be 15 to 20 minutes.
Right.
Yeah.
And then you get in to see a doctor. How many doctors do you have?
So we have 2 full-time doctors, including myself, and then actually, I'm sorry, 3 full-time doctors now, including myself, and then we have an arsenal of nurse practitioners that work alongside us. But there's always a physician there at all times.
Okay, so that we know the care is going to be exactly what we need. Tell us a little bit about your background, Bill, how you got into working with Pentucket Medical.
Well, I ran a marketing and communications business, and I've had medical practices in the past and done work for a couple of different hospitals, Anna Jake's Hospital in Newburyport, Lawrence General, and I just have a real love and passion for healthcare. Before I came to have my own business, I was the communications director for the Massachusetts Governors Alliance Against Drugs. So that was a bit of a public health slot, and so I've got a background in that. And before that, I was a journalist and news editor in a couple of different newspapers.
Wow, that's a jump.
Yeah.
That's different.
Well,
now,
yeah.
How does Express Care fit in with the structure of Pentucket Medical?
So it actually fits in really well. So first, the Pentucket Medical is basically a primary care initiative. So there's a bunch of primary cares. We do have subspecialties, cardiology, gastroenterology, I could go on. And built into that system, all of these patients rely on Pentucket Medical for their health care. Mm-hmm. Now, when you fall down at 4 o'clock in the morning, and here it is, I don't know what day it was, but say it's you fell on Monday morning. Right. Okay, so Friday morning, your doctor and their entire office is booked all day long. You call and they say, well, we wish you could see you. It sounds like you need an x-ray. You need to go to the emergency department. Well, now, with Express Care, these physicians have the opportunity to say, you know what, come right to the building that I work in, that you're comfortable with, and we have an Express Care service, and they'll see you same day.
The other interesting thing that I found is you don't have to be a patient of Pentucket Medical.
You absolutely do not.
Because I'm with another medical practice, and you just walk in, give your insurance card, and that's it.
And that's it.
So it works for both sides, for people within the Pentucket Medical practices, or for people that are outside of that particular venue.
Absolutely.
Now, there are lots of other types of walk-in clinics now. There's the MetaClinics, and CVS has clinics, and I think there's another walk-in in Lawrence. What makes this one a little bit different?
Well, I'd say from the Minute Clinics and the other things associated with the pharmacies is that I think that they're staffed with a mid-level provider with no doctor on site, where we have a physician on site all the hours that we're open. The other thing is a lot of the Minute Clinics are protocol driven, so there's not a lot of clinical decision making. You come in with a sore throat, here's the test that we get. If that test is positive, we give you this. If that test is negative, we give you this. Where the Express Care and other urgent cares really work just like an emergency department. I mean, you're getting the same service. I'm an ER trained physician that worked in the ER for 7 years, and you come to meet me. I'm just limited by the things that surround me.
Yeah. So it makes it quite a bit of a difference. Now, what are the hours? We talked about the location. It's right on Merrimack Street. It's kind of behind everything, so.
It is. There are a bunch of signs.
Right.
You just, yeah.
It's kind of in the back there, but it's right on the river.
Yep.
And what are the hours?
So 7:30 to 7, Monday through Friday. Saturday 8:30 to 4:30, and Sunday 8:30 to 2:30.
Okay, my other time was a Sunday, so
Yeah. Yeah.
it's nice to have it there. How does Express Care, either one of you, help hold down the cost of medical care? Because this
Well,
is a totally different type of thing.
The subject of containing healthcare costs is, of course, a fairly prevalent one right now. The difference really is the difference in cost, which Garrett can probably speak to better than me, but it's not an order of magnitude, but it's quite a bit of difference between what the insurance carrier winds up paying, as well as the patient and their copay, between an emergency department, which has to be triaged for all sorts of heavy, calamities, and in our Express Care, which is an office visit copay. So if we see 2,000 patients a month, and we're saving, maybe $300 to the healthcare system, so to speak, per patient, which I think is a conservative estimate, that's $600,000 a month. So that's money that isn't being paid into the healthcare system by carriers, and also, of course, the savings, the copays we already talked about.
My pocket was $18 instead of $500,
right?
Mm-hmm.
which is a big difference.
A huge difference.
Massive. So now you don't have the doctors there cannot be primary care physicians for anybody. They're only for Express Care.
They're only for the urgent care services.
All right,
yes.
I want to make that clear. So
Yeah.
somebody can't come and say, but I want you to be my primary care.
We often get those comments.
Right,
Yeah.
you can't do that.
We can't.
Okay, they can
But
go
you-
someplace else in Pawtucket Medical.
Yeah, we can always refer them to a provider that's taking new patients, and
Mm-hmm.
they can establish a primary care doctor within the PMA community, absolutely.
Okay, now, do you see children coming in?
We do. We see all ages,
Kids fall off their bikes and
all the time.
broken bones there too.
Saw 2 today.
Okay. Now, are they going to be opening any more of these?
Yes.
Okay, where should we be looking?
Well, going forward, we're looking at opening one in Andover on 93,
Okay,
and then another in the 95 area near Salisbury at some point in the not too far distant future.
okay. Amongst a lot of other things, I was very impressed with the fact that they called my normal orthopedic doctor, who said, I'm booked. There were 2 doctors in the practice. One was in surgery all day, and the other doctor was booked. And they said, she has to have a cast, and she has to have it today. And he took me on his lunch hour. So, yeah. But Express Care set that up. I didn't have to.
Mm-hmm.
So how do they interface with the other physicians, either in or out of Pawtucket Medical?
So one of the things that I think that PMA is most proud of is our relationship with the subspecialists. So, for instance, the orthopedic surgeons. So we work very closely with community orthopedic surgeons, and they know the care that we're delivering, and they're willing to take the patients that we see. So we have what's called a team associate, a woman whose job it is to interact with these subspecialists and call them, let them know what type of patient we have and what type of care that they need. And it's basically it's her job from when she comes in to when she goes home to make sure that the patients that we see get the care that they need after they see us.
She did a good job.
Yeah, that's great. That's great to hear. And the flip side of that is we have some subspecialists within Pawtucket, like, for instance, gastroenterology. We'll have somebody that come in that I would see in an emergency department, and I would admit that patient probably for at least a day in the emergency department without even thinking about anything else, ordering some tests and saying, this is what the standard of care is. You need to be admitted to the hospital to see a gastroenterologist and get these tests. At Pawtucket Medical, I can see them in the Express Care, call the gastroenterologist. This has happened twice already. They go right upstairs, they talk to the gastroenterologist, they get an exam there, and they get their colonoscopy and their endoscopy the next day, the testing that they need. They're never admitted to the hospital, and they do great. And patients really, they like that. That saves them a lot of time, a lot of discomfort.
A lot of money.
A lot of money.
And it saves the healthcare process again. So
Tremendous.
everybody saves.
Yeah.
Everybody saves all the way around.
Mm-hmm.
Well, I'd like to say thank you very much for what you did for me and
You're
what
welcome.
you did for us here today. It was very nice to meet you.
Thank you for having us
It
here.
was great to meet
Thank
you,
you,
Bill.
Beverly.
If anybody needs urgent care, think of going to Express Care because they did a great job and it saves a lot of time, it saves a lot of money, and they did a great job. So, I'm Beverly Enos. This is Spotlight Georgetown. Join us again Fridays, Saturdays, and Sundays, 8 a.m. and 8 p.m. Bye for now.